Hello friends, welcome to Shri Medipack. In this video, we are going to see the clinical anatomy of clavicle. Clavicle is also called as collarbone or beauty bone. The clavicle is divisible into lateral end and medial end. The clavicle bone extends between the manubrium of the sternum and the acromion of the scapula. Here, this is the clavicle bone. This is the acromion of scapula, and this one is the manubrium of the sternum. This clavicle bone is a long bone. This clavicle bone supports the shoulder region so that our arm can swing clearly away from the trunk. Away from the trunk refers to the body, and the clavicle is the only long bone that lies horizontally. Here, the clavicle bone has a curved part called the shaft in its two ends, that is the lateral end and the medial end. The lateral end is away from the median plane of the body, and the medial end is towards the medial plane of the body. Median plane is a plane that divides the body into equal right and left half. Here in this picture you can clearly see that the lateral end is flat and the medial end is large and quadrilateral. Next is the clinical correlations. In clinical correlations, first one is the clavicle, or commonly called as collarbone fracture. Yes, the clavicle is one of the most frequently fractured bone. Next is the functions of the clavicle. The clavicle bone transmits the forces from the upper limb to the axial skeleton. This is the upper limb. It transmits the forces from the upper limb to the axial skeleton. The clavicle bone supports the shoulder region. This clavicle bone supports the shoulder region so that the arm can swing clearly away from the trunk, which is supported principally by the trapezius muscle, and it also provides attachment for muscles, and this is the clavicle bone. Next is the weakest point of the clavicle. The weakest point of the clavicle is the junction between the two curvatures of the clavicle bone, that is, the junction between the medial two-third and the lateral one-third of the bone. Here, this is the superior view, this one is the inferior view, that is the frontal view, and this is the cross section of the bone. In this diagram, this is the right clavicle, and here 15, that is 12 to 15 percentage of the fracture occurs in the lateral one third. This is the lateral and this is the medial. This is medial two-third. Here 12 to 15, that is 15 percentage of the fracture occurs in the lateral one third. 5 percentage of fracture may occur in the medial end, and 80% of the fracture occurs in the middle third. This position This part, this junction, the junction between these two curvatures, this 80% of the fracture occurs in the middle third of the bone. Here, this is the lateral end, which is flat, and this is the middle third, and the medial end is large and quadrilateral in shape. Medial end, and this is the lateral end. So the junction between these two curvatures is the most vulnerable part to fracture. So this is the weakest point of the clavicle. And next, what are the causes of clavicle fracture? The clavicle fracture is the most common mechanism of injury is a fall onto the shoulder or onto an outstretched hand. That is, here fall with arm out onto the hand, or fall onto shoulder, or the direct blow to the shoulder. Here, the transmission of the forces to the axial skeleton in falls on the shoulder or hand, it may prove that it is greater than the strength of the bone at this site. So it is greater when we fall, it is greater than the strength of the bone at this site, and this indirect force is a usual cause of fracture. This is the usual cause of fracture. Here, these are the potential site for clavicular fracture. Acromioclavicular joint, and this one is the sternoclavicular joint. The clavicular fractures it is common in children and are often caused by an indirect force that is transmitted from an outstretched hand through the bones of the forearm and arm to the shoulder during the fall. The fracture of the clavicle, it is also common in the adult athletes like football players, hockey players. Next is the clinical feature of the clavicle fracture. When the fracture occurs, the trapezius muscle is unable to support the weight of the arm. That is, when the people with the fractured clavicle supporting their sagging limbs with the other limb. That is, after the fracture, this trapezius muscle is unable to support the weight of this total arm. It is unable to support the weight of the arm, so that the patient supporting his sagging limb by the other opposite hand, by this opposite hand. So he is carrying this man is supporting his sagging upper limb with his opposite hand. That is sagging in the sense the upper limb is hanging down too much. The weight of the arm, the trapezius muscle is unable to support the weight of the total upper limb, so that he is supporting his sagging upper limb with his opposite hand. Because the clavicle is directly beneath the skin. We can feel it, we can touch when we feel it. We can see in this picture that the clavicle bone is present beneath the skin, and it is not covered with any muscle. It is not covered with any muscle. So a fracture can be easily palpated and it is frequently seen. Right. Here in this clinical anatomy, the clinical anatomy Here, the clavicle, it is commonly fractured by falling on the outstretched hand, and the most common site of the fracture is the junction between the two curvatures. That is, this is the lateral end and this is the medial end. Here, this is the lateral end and this one is the medial end. So, the most common site of the fracture is the junction between these two curvatures. Now, it is considered as the weakest point. Now, after the fracture, this lateral end, this lateral end, it is displaced inferiorly. Okay, it is displaced interiorly. This lateral end is displaced interiorly. That is inferiorly in the sense downwards. This lateral end is displaced inferiorly, that is downwards, by the weight of the arm. And this medial end, this medial end, the medial end of this clavicle bone, it is displaced superiorly. It is pulled superiorly, that is in this upward direction. The medial end of the clavicle bone, it is displaced superiorly, that is the upwards direction. It is pulled upwards by the sternocleidomastoid muscle, and it is displaced medially. It is displaced medially by the pectoralis major muscle. Okay, first there are three things to remember. The lateral end of the bone is displaced inferiorly, that is downwards, due to the weight of the arm, because this trapezius muscle is unable to support the weight of the upper limb. So this lateral end of the bone is displaced inferiorly, that is downwards. Next, this is medially by this pectoralis major. This one is by medially and medially by pectoralis major. And next, superiorly by the sternocleidomastoid muscle. That is, it is pulled upwards. Here, this trapezius muscle is unable to support the weight of the upper limb. So, it is unable to hold the lateral fragment. It is unable to hold this lateral fragment up owing to the weight of the upper limb. That is, here in this condition, the shoulders droop. Right. Next is the anatomical basis. In anatomical basis, the fractured lateral fragment. So the lateral fragment here, this is the lateral fragment, this is the lateral end, and this is the medial end. In the lateral fragment, the bone is displaced inferiorly. That is, it is pulled down due to the weight of the upper limb. And the medial end, this is the medial end. This medial bone, it is pulled upwards by the sternocleidomastoid muscle. It is pulled upwards, that is superiorly. There is an elevation. Okay, so the fractured medial fragment is, there is an elevation. Here there is an elevation by the sternocleidomastoid muscle and medially by the pectoralis major. The gravity is downwards. This is the sternocleidomastoid muscle. This one is the sternocleidomastoid muscle and this one is a trapezius muscle. So when there is a fracture of the clavicle, this trapezius muscle alone cannot able to support the upper upper limb. Unable to support this upper limb. So this is the point. This is the fracture of clavicle point. And these are the brachial plexus. The strong coracoclavicular ligament usually prevents the dislocation of the acromioclavicular joint. It prevents the dislocation. This coracoclavicular ligament, it prevents the dislocation of the acromioclavicular joint. So here we can find the acromioclavicular joint. It prevents the dislocation of this acromioclavicular joint. So now the lateral fragment of the clavicle, it is pulled medially by the adductor muscles of the arm, such as the pectoralis major. This is the pectoralis major. And here humerus, scapula, and the lateral fragment of the clavicle will shift down owing to the gravity. Due to the gravity, it is pulled downwards. Humerus, scapula, and the lateral. This is the lateral fragment. This is the lateral fragment, and this is the medial fragment. So these everything, the humerus, scapula, and the lateral fragment of the clavicle, everything it is pulled downwards. It is pulled downwards due to the gravity. And the proximal humerus is pulled medially by the pectoralis major. The proximal humerus, okay, this is the proximal humerus. It is pulled by the pectoralis major, which may causes the overriding of the fracture ends of the clavicle. In this clinical anatomy of clavicle, the four main thing is when there is a fracture of clavicle bone. It splits into two, that is the lateral and medial end. So the lateral end of the fragment, it is displaced downwards due it is displaced downwards because the trapezius muscle is unable to support the upper limb and it is displaced downwards. And the pectoralis major, it is displaced medially, and the medial end of the fragment is superiorly displaced. That is, it is displaced upwards. It is pulled upwards like an elevation sternocleidomastoid muscle. Right. And here is a supraclavicular nerves. This is a supraclavicular nerves. This supraclavicular nerves lies in close proximity with this clavicle bone. This is the clavicle bone and this is the supraclavicular nerves. It lies in close proximity to the clavicle and are occasionally pierced. That is, this supraclavicular nerves are sacrificed during the surgical repair. And this results in the numb patch over the upper chest and the shoulder. Clavicle fracture in an X-ray. So the weakest part of the clavicle is the junction between the medial and the lateral thirds. Right. This is the medial end and this is the lateral end of the two curvatures. And next is the cleidocranial diastosis. In this condition, the clavicles may be congenitally absent. It may be congenitally absent or it is imperfectly developed in a disease called cleidocranial diastosis. In these conditions, The shoulders droop and it can be approximated anteriorly in front of the chest. Shoulders droop is the SS, that is droopy shoulder syndrome. It is what is droopy shoulder syndrome is a depression of the shoulder that stretches the brachial plexus, thus causing a pain without any signs of neurological impairment. In this picture, you can see the cleidocranial diastasis. Here, the clavicle is absent on both the sides. This condition is it is congenitally absent. That is, by birth it is absent. And in this condition, the shoulders are approximated. The shoulders are approximated. That is, it is imperfectly developed. It is, and it is approximated anteriorly in front of the chest. Thank you.